Greetings. It's my pleasure to introduce the Clevidipine for the antihypertensive treatment of acute intracerebral hemorrhage, the CLUTCH trial. I am Adnan Qureshi, the principal investigator of the trial. The trial is actually a pragmatic trial looking at real-life, real-world practices. The trial is actually evaluating two antihypertensive regimens. One is actually using intravenous clevidipine, and the second was using an alternate antihypertensive regimen, which for most parts will be intravenous nicardipine. The primary endpoint for the trial is patients with intracerebral hemorrhage that present within 12 hours of symptom onset, achieving systolic blood pressure reduction with stability. The endpoint actually captures two recommendations from the American Stroke Association, American Heart Association guidelines for management of intracerebral hemorrhage. Systolic blood pressure reduction to a value between 130 and 150 millimeter of mercury, and avoiding excessive fluctuation. So the endpoint also requires stability. So after reaching the systolic blood pressure goals, the next two consecutive recordings that are measured 15 minutes apart should also be within the range, which is systolic blood pressure values between 130 and 150 millimeter of mercury. The trial will actually look at the effect of achieving systolic blood pressure reduction with stability on functional independence, which is actually ascertained by a modified Rankin scale at 90 and 180 days after inclusion in the trial. The trial will also look at effect on hematoma expansion, that is actually an expansion or increase in hematoma volume between the baseline scan and a scan acquired at 24 hours. The primary analysis will compare the proportion of patients that achieve systolic blood pressure reduction with stability in patients treated with intravenous clevidipine and patients treated with alternate intravenous antihypertensive regimen. The trial actually is designed as a pragmatic trial, so there is going to be hospitals that will be using clevidipine as the first-line agent, and there are going to be hospitals that will be using an alternate intravenous antihypertensive regimen as the first-line agent. The data collection will be streamlined and would include data that is routinely collected as part of standard care. The follow-ups at 3 months and 6 months will be done through a telephone follow-up if in-visit or in-person visit is not possible. And using a set of standardized questions will ascertain and grade the functional independence using modified Rankin scale. So I welcome you to participate in this clinical trial. This is going to be an exciting clinical trial and one of the first pragmatic clinical trials that will give us real-world data and enhance management of patients with intracerebral hemorrhage. Thank you.